You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia.
Hello, and thanks for joining us for episode 40 of Just Medicine. I'm your host, Sandra Smiley. I use she, her pronouns, and I'm an uninvited guest on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm also a resident physician in public health and family medicine at the University of British Columbia. Outbreaks have been back in the headlines recently as Canadian authorities wind down the response to an Andes strain hantavirus outbreak on the MV Hondius and now monitor the rapid spread of Ebola virus in the Democratic Republic of Congo. That what happens in Central Africa or on a cruise ship in the middle of the Atlantic Ocean can have an effect here on the other side of the world is a testament to the fact that when it comes to health, we, the 8 billion odd human inhabitants of this planet, are all connected. Global health as an idea has this at its core, that the health of the environment and all people, regardless of international borders, is a collective rather than disparate parts. Because we breathe the same air, drink the same water, and move in the same spaces, both real and virtual, our actions influence the destinies of those around us. But the way that global health as a field has grown up, that influence is disproportionately concentrated in the hands of a few, resulting in enormous health inequities within and across countries. Our guest on the podcast today is Dr. Madhukar Pai, a public health physician, professor, and Canada Research Chair of Epidemiology and Global Health at McGill University in Montreal. Also a prolific writer and editor, Dr. Pai contributes a regular column to Forbes magazine, maintains a strong and authoritative social media presence, and has served on the editorial boards of several high-impact journals, including as inaugural editor-in-chief of PLOS Global Public Health. Dr. Pai and I took a deep dive into what global health is, where the idea originated, and why the field urgently needs a reimagining. We talked about what role there is for medical learners and trainees in addressing global threats to health and equity, and, despite tough times, why there's still cause to be hopeful about the state of the world. Here's my conversation with Dr. Pai. Have a listen. Hello, Dr. Pai. Welcome to the podcast.
Thank you for having me, Sandra.
To get going, can you tell me a bit about your career as a public health physician and epidemiologist?
So I grew up in a small town in South India called Vellore, in a middle-class family. Neither of my parents went to college. So it was a pretty big deal when I got into medical school. And I would say my medical school was pretty normal within the Indian context. But somewhere along the line, something happened. I kind of started attending some activist-y type of groups, which introduced me to the whole idea of social justice in medicine, on the need for community and preventive health care, not just curative medicine. And so I think that light bulb moment made me realize that clinical medicine was not my future, that I wanted to keep populations healthy and prevent them from falling sick in the first place. So I decided to do my residency in public health and preventive medicine. In India, we call it community medicine residency. And then I realized I really liked research, and I wanted to pick up a degree in epidemiology. I was very privileged to get a scholarship to go to California, Berkeley, where I did my PhD, postdoc at UCSF, and then moved to Canada 20 years ago exactly to join McGill University as an assistant professor. And I'm still here, where I'm now the chair of the Department of Global and Public Health.
Wonderful. Thanks for that. And can you give us a rundown on what being a public health physician looks like? What does your day-to-day consist of?
I don't do any clinical work anymore. So my public health research is primarily two types. Research. I work on a disease called tuberculosis, which is a huge public health problem globally, of course, but also in parts of Canada, and we can talk about that as well. In addition to tuberculosis, I work on, antimicrobial resistance. I did a lot of work on COVID. So infectious diseases and global health would broadly be my area of my passion. But I also teach a lot. I teach global health to undergraduates, to medical students, to graduate students, and mentor a lot of people who have graduated. So It's an enriching type of a day because I do research, I do teaching, and I do administrative leadership role as the chair of the department.
Okay, Dr. Pai, you mentioned global health. What is global health?
I think simplistically, global health would mean that the health of the world is all connected, right? So I think the pandemic was a beautiful example of how small the world was, that everything and anything can easily move across borders and boundaries. Climate change is a wonderful example of how connected we all are, how climate change will impact the entire world, not just one country. So anything that talks about the health of the planet and all of the people as a collective would be a natural way of thinking about global health. And then when we come to just working in one city or in one population, then the local public health becomes relevant, right? So there's a local and there's a global, but they're all invariably interlinked.
Can you tell us a little bit about the history of global health? Where does the term global health come from? And surely it's evolved over time. So if you can tell us a little bit about that, it'd be interesting too.
Yeah, so the understanding is, if you read history of global health textbooks, that it primarily came from colonial times. So during the colonial days, whatever the white colonizers were dealing with, malaria, yellow fever, or whatever they're dying of, cholera, they put in a lot of efforts to keep their troops healthy and to not die. And so they invested in tropical and other diseases. So that colonial medicine slowly morphed into tropical medicine and hygiene, as it is still used. A diploma in tropical medicine and hygiene is still offered. And then it became kind of international health for a while. The international health had that feeling that the rich world is somehow going to the poor world to save them. So I think people decided that more better terminology that reflects the bidirectionality would be global health. So these days, global health is the favored name. Regardless of all of that, I would still say global health is still dominated by elite and privileged and global north countries. And I think the devastation caused by US governments ending of USAID and all of that are pretty telling commentaries on how power differentials literally shape this field, right? Somebody in Washington, D.C. switches a button and somebody else dies far, far away. That's not how it should be, but that's exactly how it is. So global health is still a very power asymmetric field, even years after colonization ended.
Yeah, Dr. Pai, you run a course at McGill University where you're faculty called Reimagining Global Health every summer, right?
That's right.
Why is the concept of global health, as it's conceived in these elite institutions in Ottawa or London or Geneva, in such sore need of reimagining? Let's unpack that a bit.
That's a great question. So I think we can see abject failures of global solidarity all around us, right? Take the COVID pandemic example. I mean, in a catastrophic global pandemic, global north countries primarily hoarded vaccines, did not share vaccines in a timely manner, did not allow low and middle income countries to manufacture their own vaccines. And all of that resulted in a lot of avoidable death. And we saw all of the silence around all the wars and conflicts and genocides, which also tells us that the global health community is failing in solidarity. We also see climate crisis as being caused primarily by global north nations, but global south countries are not being offered reparations for the damages that we have caused. So there's any number of examples of global health failing in a repeated manner in terms of equity, right? So if you say that every time global health fails in equity, then there has to be a structural reason why that is the case. And the structural reasons, in my opinion, is that the field itself is structurally inequitable. And therefore, an inequitable field cannot fix health inequities, right? We repeatedly fail because we are structured to fail. And that's because every aspect of global health and development is tightly controlled by the elite global north institutions and individuals. That includes people like me and you. We are all part of this elite privilege structures, and we are dominating the field. For example, who gets all the money? It's mostly us. Who writes the publications? It's mostly us, right? Who's giving the talks? It's us. Who gets to decide what research needs to be done or not? Where are all the biggest philanthropic organizations located? It's the Seattles, the Washington, D.C.s. And so when every aspect of global health is structurally controlled by the elites, our conception of global health then becomes one of charity. We see global health as a charity case. Oh, we will give you vaccines eventually. You wait for your turn, we will give you antiretroviral treatment, right? Your health depends on our generosity. And sometimes we are generous and sometimes we are not. Like we will shut down USAID in a few weeks if we choose to, right? Right now, every global north country is reneging on their international aid obligations, right? That's not how the world should be, right? Nobody's health should be dependent on whether Canadians are feeling generous or not. So I think that's what needs to be reimagined. Why is global health so structurally inequitable, continues to be inequitable, highly visible in the last 1 year, I would say, with the US government leading the way on a very transactional global health, if you wish, right? We will give you aid and you give us mining rights, right? This is so like devastatingly plain. I mean, it's in your face, right? There isn't even a pretense of charity anymore. It's all about what's in it for us. So I think the world, global north in particular, has forgotten how interconnected we are with the rest of the world, and we need to remind ourselves that.
So, global health is, perhaps as a reflection of its origins, a structurally inequitable thing, process, system, whatever you want to call it. You use the word solidarity, and I'm just wondering on the individual level, you're speaking to medical learners and trainees. What does that translate to? What does this look like in practice, especially from the vantage point, as you said, of our
Mm,
ivory tower? We are
mhm,
the elites that
mhm,
have access
mhm,
to the money, to the
mhm,
institution, to the
mhm,
power currently in
mhm,
this inequitable superstructure. What does that
mhm.
look like? What does that solidarity look like?
I think we need to see solidarity. I sometimes use the word allyship in my papers. I somehow like that a lot. So global north, individuals and institutions, we need to be better allies to global south communities, right? Men in global health need to be better allies to women in global health, right? At an individual level, that's an important thing. White folks need to be better allies to people who are Black, Brown, Indigenous. And the list goes on and on. So I think solidarity means standing in solidarity with a group that has been denied equity historically or today and working with them to dismantle the things that are keeping them denied in some way of equity, right? Or groups that have been oppressed, standing in solidarity with them and saying, what can we do to dismantle the structures of oppression? There is a lot I think we can do as individuals without wanting or needing anybody's permission, right? I can right now choose to be a good ally to women around me. Anyone, nobody needs to tell me that I can or cannot do that. But as an institution, what do we do? What does McGill do? What does UBC do? What does the Canadian government do? Right? And so continuing to support multilateral institutions, continuing to support humanitarian causes is one way to demonstrate allyship, right? That we are concerned as Canadians, that we are saddened by these wars and conflicts, and we will provide humanitarian assistance. That's an example of allyship. And we absolutely should do it because we are a wealthy nation. We can afford it and we should do it because that's our obligation, right? So I feel like that the world is failing. Global North as a whole, if I could just paint them with a bigger brush, I know there's variation within the Global North. I know the Global North is not a monolith, but I think I'm worried that the Global North has become deeply inward looking, has rapidly lost democracies in many parts, United States being a scary example, is swinging towards far right, authoritarian, right wing ideologies, which is innately antithetical to solidarity. It's antithetical to human rights, and human rights and international laws are being violated on a daily basis. And these populist leaders have spun this whole tale where they have chosen to other people, right? Immigrants, refugees, international students, finding someone to victimize. So we are in a world of mass deportations. We are in a world of extreme border controls. We are in a world where refugees are not seen the same, right? Refugees from one country are welcome, refugees from another country are not welcome. So I see everything as being connected. I don't see them as separate entities, right? Our border policies and our vaccine hoarding are all connected, right? They're not independent things. So understanding this bigger picture of why the world has changed the way it has is an important way of understanding what stands between us and solidarity. Why are we not doing the right thing in terms of reparations, right? For climate change, for colonial damages. I mean, we didn't even want to vote on the UN resolution on slavery, right? Which is such a, you know, a child could have told you that slavery is a crime and every
Yeah.
country should have said yes. And yet, those who benefited the most from colonialism and slavery chose not to vote or chose to vote against the resolution. So it says a lot about how global north countries are thinking. So solidarity right now seems like a myth, but that's exactly why we should all, when I say we, those of us who are in medicine, public health, global health, those who believe in social justice, we have to go back and become pro democracy advocates. Because without democracy, there is no chance of solidarity. Not only do we need to fight for democracy, I think we also need to fight for human rights. Not just human rights, universal human rights. The same rights will apply to you, me, someone in Palestine, someone in Iran, someone in Lebanon, someone in Venezuela, immigrant, refugee, doesn't matter who they are. So long as they're a human being, they have every right that you and I have. And that universality is absolutely critical to fight for. So, a long winded answer to tell you basically that solidarity is a scarce thing right now, but that's no reason to give up on it. That we need to seriously double down on basics. And the basics for me, the non negotiables for me, is respect for humans and human rights, respect for all countries, regardless of who they are, what they are, right? And respect for international law, which many countries have forgotten, that we need to remind them about, right? And I think it's going to take enormous amount of work to overcome the tidal forces of right-wing populism that is now exploding everywhere.
I'm hearing that there might be a role in there for you and me and all of us on the ground making up the collective in advocacy for democracy and human rights, which, of course, we know now that we've expanded our view of what health consists of with the social determinants and structural determinants of health, are determinants of health. Would you say that's an accurate summary?
Absolutely. I think I see everything connected as, I mean, you think of it as like concentric circles, right? That we start with ourselves. So we obviously need to care for ourselves, then our families, then our immediate neighbors, community, relatives, friends, and then our countries, wherever we happen to be, all of humanity. Even that's not enough because we are so reliant on plants and animals. So we need to care about them and then need to care about the ecosystem that nourishes us, right? So if we did that, then we would have more respect for the planet and its climate and the importance of acting on climate change. And I would say even respect and concern for unborn generations, right? Because if we are going to be into climate denial spiral that the leaders are in now, What is our obligation to generations that are yet to be born? Why are we sacrificing their futures for our current wars and oil and stuff like that, right? So Desmond Tutu said it so beautifully when he said, I'm human because of my connection with you, right? I'm human only because my humanity is bound up with yours. And so there is no separate existence as humankind without others. And sometimes we forget that and we need to remind ourselves. So, yes, the future lies in being parts of pro people, pro democracy, pro human rights movements, not individuals, but collective efforts.
Wonderful. It's a good reminder that we individuals do make up a collective that can be pretty powerful when everyone's compass is pointing in the same
Well, we
direction.
saw that in Minneapolis, right? The people
Mm,
of Minneapolis
mhm.
demonstrated what it really means to stand up to injustices. So there are contemporary examples everywhere. I mean, there are Americans who are fighting very hard to save their democracy. So people everywhere are still actively mobilizing. Rebecca Solnit has a wonderful new book. And I remember a wonderful quote from her. The future is not written, meaning everything is not preordained, right? So there is nothing inevitable about bad stuff that's happening, right? If it's not inevitable, we can change it, which means we need to play an active role in creating the future we want to see. And that's, I think, a hopeful message for young people in particular, because I'm struggling to teach global health these days. I wrote a whole piece last week on how terrible it is to stand in front of young people and honestly talk to them about the world today, right? And they are flabbergasted. They're saying, "What the hell's going on?" And I have no answer, right? There's no way to explain to them. I think they're all wanting to figure out what they can do about this ongoing crisis. And we have to give them something to latch on to. And the best way to think about it is, yes, things are bad, but the future is still yet to be determined, and there is a chance for you and I to work together to bring about the future that we want to see. That could be something as simple as going and voting in your next elections. That could be running for office. That could be writing a letter to your minister, your MP, your prime minister. So that I give them a whole list of things that they can do. So just to tell you that it's paralyzing, the geopolitics and the oligarchy running wild, but there is some power that people still have. And I think it's good to remind ourselves that we still have some agency. And where there's urgency, there is agency, and we can do something about it.
I think you posted the PowerPoint slide that
Yes, I
you
did.
present,
Yes.
yeah, on
Yes.
LinkedIn, and I
Yes.
will most certainly be asking you for that to link out through the show notes.
I was so alarmed that my global health lectures have become so dark and terrifying and depressing because it's real, right? I didn't make the world the way it is, but I certainly have to start there, right? Because if I glossed over everything that's happening now, of what use is that global health lecture, right? So global health lectures have to start with the realities of the world, as bleak and bad as it is. And then how do we come out of it, right? So the way I have made peace with that is I tell my students the first half is going to be horrible, beyond horrible. Don't drop out. Come back next week. We'll continue the conversation, and I will try and pull us out of this abyss. And that's when I realized I should go armed and prepared to give them slides on what they can do. Taking a course in global health itself is an act of resistance today because you're saying, I care about the world. So our leaders and politicians have normalized such horrible things that even taking a global health course seems so radical and woke, quote unquote. Well, it's so normal to even care about others and normal to care about the rest of the world. And it's very normal to think about equity. So we need to kind of rebalance this and bring it back to where it needs to be.
I agree. And I don't wish to drag us down further into the darkness, but I was hoping to talk to you about disinformation And this seems like a good time to do it. You mentioned climate denialism. You're talking about advocacy and activism. And the online space is such a fertile one for doing advocacy and activism. And let's face it, we are in a time where the information environment online is so saturated with disinformation. And of course, that's a determinant of health too, right? The
Absolutely.
availability of disinformation and incorrect misinformation. So, yeah, I know you've done some work on this and around how disinformation is influencing the uptake of really evidence-based bread and butter public health interventions like vaccines. Do you have any pearls for medical learners and trainees noting this on promoting these public health interventions, both at the individual level as well as the advocacy level that we were talking about before?
I think the first thing I'll say is we need to understand that disinformation is intentionally being spread. It is a well-funded activity. It is bankrolled by dark money. I mean, this isn't a conspiracy theory. These are all well documented. And there is a spectacular new book called Science Under Siege by Peter Hotez and Michael Mann. Peter Hotez, as you know, is a vaccine scientist, and Michael Mann is a climate scientist. And boy, oh boy, have they seen attacks and threats to themselves and discrediting their work. So when two amazing scientists get together and tell us why the hell science is under attack, who's spreading the disinformation, who's amplifying it, who's bankrolling it, and why, everything becomes clearer to us. I used to naively think that these guys are misguided. I don't think that anymore. Like, for example, it's not climate denial, it's the intentional denial of climate change by leadership funded by oil and gas lobbies. It's as simple as that, right? The oil and gas lobby absolutely bankrolls politicians who then stand up on the stage and say climate change is a hoax, and it continues. And then there's all these influencers who are paid to transmit that message. So it's a whole amalgamation of things. And so, for all of us who want to correct the disinformation, the first step is understanding this whole ecosystem, right? Who benefits? Follow the money trail. What is the connections between all these people? And so that's why books like Science Under Siege are so spectacularly important because we get to see the big picture, right? Otherwise, we will be fighting an enemy that we don't quite understand, right? We need to first understand. Secondly, I think if we want to do something about it, we need to also get politically active. When I say that, I'm not talking about being partisan or anything. I'm talking about being more involved in political processes. For example, why on earth is RFK Jr., an anti-vaxxer, running the healthcare of a country? How did that happen? What can we do about it? And obviously, there are people working on that, right? To make sure people like him are not involved with that. And at a more basic level, there are people who are saying, okay, let's work with grandparents who understand what the world looked like prior to vaccines and get them to convince others to talk to their grandkids, to talk to their children, and make sure people get vaccinated. Let's work with the good media. There's obviously dark media, but there's a lot of good media. So let's have good people, pediatricians, right? Trusted people appear in media to tackle the disinformation. So I think certainly for Canadians, we need to vaccinate Canadians against American disinformation right now. America now is one of the biggest sources of disinformation, bar none, right? So, and it's coming right from the top. So, I think Canadians and Canadian experts and Canadian media, we need to do a lot more to almost prophylactically immunize our population against the misinformation that's coming, right? So, for example, when RFK and others started this whole Tylenol and autism bullshit rumor, I asked my pharmacoepidemiology colleagues to write a piece in the news op-ed saying that that's not true. Here's what the evidence says, and it got published. So every time something like this happens, we need to activate all of the thoughtful, good scientists get them onto the news networks, get them on social media. So, yes, the online platforms are dominated by the disinformation gurus, but there are also good people online that we can and should activate and become more visible, right? Otherwise, the darkness takes over the good stuff. So, lots of work to do, and there are some really nice people working in this area. There are movements that have cropped up. There is a movement called Stand Up for Science. There's a movement called Defend Public Health. Lots of people are thinking hard about how to counter this barrage, the tsunami of bad stuff that's coming our way.
So what I'm hearing is that potentially, obviously, subject to people's comfort levels with social media and the online space, because it can be a bit of a cesspool, as I think we all know by this point.
True, true.
Um, yeah, a potential role for medical learners and trainees as they move through their training and
I
become.
think your podcast is one way to do it, right? You do podcasts with good, thoughtful scientists. You're contributing to addressing misinformation. The
Yeah,
Joe Rogans have a reach that is
yeah,
far
Joe Rogan, eat your
beyond
heart
that.
out.
But we have to do something, right? That's why
Yeah.
I write a lot for the public. I post a lot on, good platforms.
Hmm.
Not Twitter, certainly. Twitter is dead, but good platforms we can continue to work in, and people do appreciate that, right? Yes, there is the occasional troll, but overall, I would say when good scientists post, they will get seen and known. So I encourage doctors who are passionate about this to be unafraid to speak to the media, be unafraid to write op-eds, right? The good stuff has to somehow counter the bad stuff. It's a battle fighting for science.
Yeah, I saw Maria Ressa, the CEO of Rappler, speak a couple of weeks ago in unceded Vancouver here, and she said, talking about the social media algorithms that, have us all glued to our screens. She said inspiration travels as fast as anger does online.
Mm,
And,
mm,
I read that as a call to action in a way, as a budding public health professional,
mm.
that there is a place for that expertise online, and it does have the potential to spread and to enlighten people.
That's
So,
great.
yeah, thank you for that excellent answer. And, finally, I was hoping that we could talk a little bit about tuberculosis. You brought it up at the beginning of our conversation. I've heard you speak in other fora about the role that tuberculosis played for you early in your medical career. And I just wanted to hear from you, what does that work look like today? What journey has tuberculosis taken you on in your career? And what do you think that the people listening to this podcast, medical learners and trainees who are working in so-called Canada, what do they need to know about tuberculosis?
Great question. So I never met my mom's dad, my grandfather. Even my mom doesn't remember him because he died so young of TB. And that was way back when, before anti-TB medicines were even created. So during medical school and residency, I saw a lot of TB and leprosy, and I did a lot of work clinically in those areas. And then during my PhD, I decided to do my PhD thesis on TB, and that's it. I've been continuing to work on TB for the last 30 years. So I'm a lifelong TB researcher, advocate, policy geek. I think we've made progress, but it continues to be the world's number one infectious killer of human beings even today. For a while, COVID took the first spot and TB became the second. Now COVID's less and TB is back. And no surprise, everything about TB tracks with the social and other inequities, right? Wherever there's poverty, there's TB. Wherever there are wars and conflicts, there's TB. Wherever there's malnutrition, there's TB. So TB thrives, all these social determinants. It's a classic example of how important social determinants are. So it's a genuinely a quintessential socio-political problem, not just a biological problem. And therefore, even in the richest parts of the world, like us, you still find TB outbreaks in indigenous communities. Not because we don't know how to cure TB, not because we don't have money, not because it's a biomedical puzzle. It's not. It's a social problem, right? It's a problem of neglect. It's a problem of racism that we haven't done enough to improve the societies that are still struggling with overcrowding and poor housing and all sorts of social determinants. So that is a sad reminder that even in the wealthiest parts of the world, TB has not gone away because we've not done the right things for these communities, right? We've not addressed the social inequities, and therefore we've allowed these pandemics to thrive in these settings. If we want to, we could have easily gotten rid of TB. We still can. I'm still hoping the Canadian government will do the right thing and make sure the Indigenous TB elimination plan is fully funded so that we can get rid of this damn disease from the country, right? That doesn't mean TB will disappear, because refugees and immigrants will still have TB at a higher rate than the Canadian born population. And that's why I think TB demands a more global approach, right? It's an infectious disease that will cross boundaries. So therefore, we need to focus more on global south countries with very high TB rates even today, and address the problem where it really starts.
Dr. Pai, I think this relates back to what you said at the very beginning of this conversation about the local being connected with the global, and global health being an all-encompassing concept, or in a reimagined form, it should be. It sounds like from what you're saying that tuberculosis really goes anywhere it wants to, as long as it has the right conditions, which are
Absolutely.
inequity.
Beautifully put. Beautifully put. Yes.
Which
Yes.
are, yeah, inequity, poverty, structural
Mhm.
violence, and so
Mhm.
on.
Mhm. It's kind of sad that there is still so much stigma around diseases that for which, it's a respiratory bacterium, right? That's about all it is. So whether it's COVID or influenza, any of us can get it, all of us can get it. It's just a matter of breathing the air in the right environment that will get the TB bacilli into our lungs, and then it starts off. But I think it also tells us how interconnected we are, right? We are breathing the same air, and therefore we should care, right? It's as simple as that, that there is no way to be immunized against respiratory infections, and it nicely links our individual destinies with a common collective future, right? COVID did that beautifully, right? There was no way to run from an airborne respiratory virus. We tried hard, but it found us. It reminded us how connected we are. Same thing with vaccines, right? If I decide not to vaccinate my kid against measles and your kid gets measles, I am somehow connected, right? There's nothing we can do to run away from these realities. I think that is the beauty of public health, that public health is a shared responsibility. Yes, you do the right thing for yourself, you exercise, you eat well, whatever you need to do, but your health is in some way reliant on my health too. And my decisions impact you, your decisions impact me. So long as we live on this small planet together, 8+ billion of us, there is no running away from common shared responsibilities, and therefore the need for shared actions, which is what public health is all about.
I think that's a great way to end it here today. Dr. Pai, it has been such a pleasure. Thank you so much for taking the time to speak with us today.
Thank you, Sandra.
That was my conversation with Dr. Madhu Pai, a public health physician, writer and editor, professor, and Canada Research Chair of Epidemiology and Global Health at McGill University in Montreal. Here are a few pearls that I took away from our discussion. 1. Global health as an idea can be summarized as follows. The well-being of everyone and everything on this planet is connected. It also acknowledges the determinants of health, like the air we breathe and the earth we inhabit, are shared among us, and that with that sharing of resources comes a sharing of responsibility. The goal of global health, the idea, is to make good on that shared responsibility and optimize the health of all collaboratively. 2. But the way that global health as a field has grown up, power and influence is concentrated in the hands of the few, resulting in palpable disparities in health. The field has its origins in colonization and colonial medicine, and remains dominated by people enjoying various forms of privilege based largely in global north cities like Ottawa, Washington, London, and Geneva. Although colonization ended in name decades ago, in the field of global health, power asymmetries persist. 3. So there's a big gap between the promise of global health and the way that it is done in practice. And here in Canada, we don't have to look very far to see this. Tuberculosis is a disease that flourishes in spaces where social determinants lack. And we continue to battle outbreaks in this country, one of the wealthiest on the planet, and where the best treatments and diagnostics are at our fingertips, because tuberculosis is just as much a social and political problem as it is a biomedical one. 4. Political advocacy is a form of solidarity with groups who are denied equity. Here in Canada, we still live in a democracy. There are lots of things that you can do to make sure our leaders know that health, human rights, and equity are important to you. Write a letter, draft an op-ed, run for office. It's normal to care about other people, the planet, and the rest of the world. It's also normal to constructively make your views and values known to your elected representatives. 5. Between climate change, cascading conflicts, and accelerating human rights abuses, there are many challenges that face us 8 billion inhabitants of this earth. But there's also plenty of cause for hope. Like we've said before on this podcast, as medical learners and trainees, we have both expertise and influence. We can use the privilege that we hold to resist injustice, dispel disinformation, and promote health. And as Dr. Pai reminds us, the future has yet to be written. We can put pen to paper in pursuit of a better and more just tomorrow. Thanks so much to our guest, Dr. Madhu Pai, for talking to us for this episode of the podcast. If you'd like to access resources relevant to our conversation, check out the links in the description or our Instagram or Blue Sky posts on this episode. And thank you for listening. I'm Sandra Smiley.
Thanks for tuning in to Just Medicine.